So I am Mallory Jayroe. I work at the Arkansas Department of Health. I'm the infectious disease FB supervisor, and I also am the SEDNet coordinator for Arkansas. So that is surveillance for emerging threats to mothers and babies. It is a CDC funded program, and we work with moms and infectious diseases. And right now we're focused on syphilis that affects moms and babies. So at the HPG Summit, I talked about congenital syphilis and really talked about what's going on in Arkansas and what we're seeing. And so we're seeing very high increase and substance use, mental health issues, no prenatal care, as well as providers not testing and treating. And so my point at the HPG Summit was to really just talk about what's going on, because a lot of times when we talk about different infectious diseases, syphilis gets brought up, but not when a maternal health aspect. I go to many maternal health conferences, many maternal health spaces, and a lot of time infectious diseases aren't at the table, and that could be for a variety of reasons, but obviously a big reason is stigma with this disease. So that's kind of what I presented on and really focused on what we're doing here in Arkansas, because we have been doing some work in the past 3 years, like partnering with HPG individuals, as well as Perinatal Quality Collaborative. We're doing an initiative right now where we are testing every mom at delivery. And so in Arkansas, we did a law in 2021 where you're supposed to test for providers, test at the first and third trimester, and if not done during prenatal care, at delivery. Then we started noticing that these moms are not getting prenatal care and they are still not getting tested delivery, i.e., then the babies might have congenital syphilis. And with congenital syphilis, it's very detrimental to the baby. They can have different adverse effects, and one of those being death. And we actually have had babies in the past in Arkansas pass away from this very preventable disease. And so we really talked about that, as well as our advocacy work with Perinatal Quality Collaborative to also let the hospitals know, because I go around and we talk to OBGYNs and they heard about syphilis in the residency and they haven't seen it since, and they are actually confused about the good treatment and pattern, because though syphilis is easy, it's kind of complicated. And so we're really working hard to not only educate the public to be advocates for themselves, but also providers. So one of the main things I wanted people to take away from our presentation, and what I've kind of been on for the past 3 years, is really having congenital syphilis at the table when we're talking about maternal health. Right now in our state, we have a big push for maternal health, but I still don't see this infectious disease at the table too. So I really want people to start focusing infectious diseases with maternal health and maternal health space, because it is a part of maternal health, because the same things that they talk about, mental health, substance use, it's the same population. And this is easy, right? You test and treat and you go about your merry way, and then you do education. And so that part is easy. The part that's hard is the mental health, substance use, prenatal care. But we can focus on that if we can just get rid of the syphilis component and really decrease it. So I really want people to take that away. I also want people to take away that there is a syphilis epidemic happening right now. It hasn't gone away. It started increasing in 2017 and it's gone up and up. And we're still seeing the same things with, no prenatal care, substance use, mental health. But when I talk about risk, I also want to make sure that people know that just because you have a risk factor does not mean you're automatically going to get syphilis, or you should only be targeted to be tested. Because when we looked at data, we saw that at least 30% of moms actually didn't have any risk factors. So that just means that, I know this sounds silly, but the CDC says it too. If you're having sex in Arkansas, you need to be tested and treated, or tested for syphilis, no matter what. Even if you don't have risk factors, even if you have the same partner, you never know what's going on. And so we want to definitely get tested no matter what. At HPG Summit, this is my third year going, and I always like to go because I like to hear from the community, right? Like I'm in the, health department space, and I see always at the table on the kind of the big decisions. But I think community partners is the most important thing and kind of the backbone of public health. And so being able to talk and see their experiences, have our ideas, what we're seeing in the data, and then be able to relay that. And they say, this is what we're seeing and this is what does work and doesn't work, because we know that different things don't work in different communities. And so having people be in those communities and having lived experience kind of help us navigate and do what's best for the people of Arkansas.